Invisalign A to Z. I'm going to tell you everything you need to know about it, start to finish. From the start, and everything's included. What we do is we take photos, impressions, x-rays. 3 weeks later, you come in and see me, and I show you on a computer screen a computer animation of your mouth moving from start to finish. You get to make sure that I'm going to move your teeth exactly where you want. It's also going to tell us how many trays you're going to get. This is an Invisalign tray, right there. You wear that, a new tray, every 2 weeks, and so it's going to tell us how many trays, and therefore it's going to tell us how long treatment will be. The average case is 11 months. Yours may go a little longer, a little shorter, everybody varies, but we'll know exactly from the ClinCheck. 2/3 of people go exactly as predicted on that ClinCheck. 1/3 do not, and there's only one reason that someone isn't going to go exactly as predicted. It's because you're not wearing the trays 22 of 24 hours. You wear the trays 22 of 24 hours, goes nice and smooth. Human nature though, about 1/3 of my patients end up having bigger, better reasons, other excuses, and not wearing the trays as much as they need to. So what we'll do there, out of my last 300 patients, we've had 94 of those who have not worn the trays. We stop the case and we start over, meaning I take new impressions, new photos, I get a whole new box of trays, and we give you those. Great expense to me, no expense to you. So I will restart it because I want everyone happy. So once you approve the ClinCheck, 3 more weeks go by, we get the box of trays. So let's review. We take the impressions photos, 3 weeks the ClinCheck where you look at your computer animation, 3 more weeks you get the box of trays and we start wearing them. So it's 6 weeks from the point at which we take the impressions. Things during treatment. 1, I'm going to lighten your contacts. Right now your teeth are probably pretty tight. A flimsy piece of plastic will not move teeth. So what I do is take a little topical gel, sanding strip. You'll feel pushing and pulling, but no pain, and that will help us to move teeth. The only difference you'll see is you'll be able to floss easier, which is clearly a good thing. At certain points in treatment though, I'm going to need to create space for most people. Most people have this much tooth structure, but only this much space. So what we do is something called IPR, interproximal reduction, which is the exact same procedure as lightening your contacts, topical gel, sanding strip. You won't appreciate it, but it will get your teeth moving. This will create a minuscule amount of space. A couple of tenths of millimeters are what we're really talking about. Very, very small. And all that will create enough space where your teeth will uncrowd and all that space will be gone. The third thing you need to know about during treatment are buttons. Buttons or attachments are tooth color material applied to the front of your teeth per the ClinCheck, that computer animation, and that helps us move your teeth where you want. Make a fist for me. So, one example of a use of a button is rotation. I'm going to rotate, hold tight, not holding on pretty good. If you put your thumb out for me, this would be a tooth color material glued to the front of your teeth towards the beginning, taken off at the end, no harm, no foul. And what it does is to help me move the tooth where you want it. Now, treatment's over. When you're happy, we're done with trays and I'm happy. At that point, I get you your first set of retainers. Retainers are this, but thicker. And you wear them every night for the rest of your life. Research says every 2 years you should get a new set. It stretches. So I don't provide you a lifetime of retainers, but I do provide the first one, the first set of retainers, upper and lower, and that way it's going to keep your smile stable where you're happy. But for future, you'll need new retainers. For a lifetime, I'm not providing. So you can get that here, or you can get that any place that provides Invisalign, but you do need to know about that cost. Finally, the last additional cost that I can fathom is if you lose a tray. 2 issues with that. 1, Invisalign's going to charge me, I'm going to charge you. Current price is $84 a tray. 2, the bigger problem is, if you lost a tray, it meant it wasn't in your mouth. If it wasn't in your mouth, it's not going to work. I want this to work. So you're not going to lose trays because they're going to be in your mouth, and you're going to be wearing them 22 of 24 hours, and your teeth are going to move exactly where you want them. Question.